Good afternoon. It's Saturday, May 15th, 2010. Welcome to the show. I'm the host, Michael Weiss. The topic for today's show is healthcare and the web. What's taken so long? And now, if you have a chronic illness, you'd more be apt to say, what's taken so effing long? But I don't want to use any profanity in this show. But I do have a chronic illness. So for those of you who haven't seen the show before, my name is Michael Weiss. I'm the host, and I have Crohn's disease, which is an autoimmune, incurable gastrointestinal illness, which I've suffered from for about 25 years. I've had about 100 hospitalizations, probably more, 15 major surgeries, and I've suffered from every major complication and side effect possible. I actually wrote a book about my experiences called Confessions of a Professional Hospital Patient. And if you're a chronically ill patient, I think you'll really dig this book. It's a funny look at what it's like in and out of the hospital in terms of dealing with a chronic illness. It's funny because I try to give it the right perspective, and I emphasize the incredible support I got from my friends and my family. And for parents or friends of people with chronic illness, I think this book will give you insight into what they really deal with. And obviously, it's a great gift for a hospital patient. So when you get a chance, check it out. You could purchase it on Amazon, Barnes & Noble, or even on my site, which is hospitalpatient.com. Okay, thanks. All right, so why'd I pick this topic? I picked this topic because I didn't feel great yesterday, and I was thinking, wow, there must be a way to use the web to somehow get some treatment or care today. Now, I didn't really need the treatment. I knew what was wrong with me, and I knew how to take care of it. But I started thinking, with all these technological advances that we have, with the smartphones and the iPods and the iPads and these incredibly smart people with startups and web initiatives, how come nothing's happening in healthcare? Well, I did a little research, and obviously there's a lot going on in healthcare, but it hasn't yet reached out to affect us patients. And what I mean by that, there are some great companies doing some incredible initiatives, such as Google Health, Microsoft Health Vault, Revolution Health, WebMD, and the Cleveland Clinic. And there are several more, but those are the big ones. They tend to concentrate on what's called personal health records or electronic medical records, which are EMRs. Now, these are basically credit cards with all the information on a patient. So you travel around with this little credit card so that, God forbid, something happened to you, someone could just put this into a reader of some sort and know everything about you, your illness, your medications, your surgeries, your most recent tests. I mean, it's a fantastic idea. But as you can imagine, there's a lot of politics holding it up, and hospitals and medical facilities, they need to agree on a standard so that these EMRs are all the same. And that's taken a while. And I wonder if it's taken a while because of politics, or maybe health insurance companies want to slow things down and they can make as much money as possible in the interim. I mean, it's a business. I'm not annoyed at health insurance companies for doing that. They're a business. But what I do get frustrated with is, I remember when we used to worry about using the web for banking. We don't anymore. People trust the web to do banking. People trust the web with their credit cards. Healthcare? Come on. I mean, it's $1 billion business that's pretty much kept together by handwritten notes from doctors to nurses to pharmacies. And I think chronically ill people are the ones who would benefit most and actually are suffering the most now, because it's frustrating to see the smartest people in the world, whether it's Silicon Valley or venture capitalists and whatnot, where are they? Why can't they make this work for healthcare? I think the healthcare reform bill that President Obama got passed is a great start, but really, where's technology? Look, I could have used Skype to call my doctor, and that would be great. So he could check it out, check me out, and say, it would just give me peace of mind. So Skype is available where we could have virtual doctor visits. And there are people doing this. It's just not standardized. There's also hospitals and people doing some great things, very much in sync with a website called Yelp, YELP.com. Yelp is a site where consumers will rate their experiences at restaurants and other types of consumer-oriented experiences. And then people will read it, and say, well, hey, that looks pretty cool. I'd like to try that restaurant. And obviously, you can't really tell from just one opinion, so Yelp has really grown. And then when you have about 20 opinions on a restaurant and you read all 20, you have a pretty good idea as to whether you want to eat there or not. Well, hospitals are doing this with different procedures. For example, a patient may agree to blog about his or her experiences for their knee surgery at the hospital, or their plastic surgery at the hospital, or a doctor may ask someone to blog about like an eye procedure or their cancer treatment. And then, us as patients, we read that because we're contemplating treatment. We're contemplating treatment at a specific hospital. I think that would really help. So there's just so many ways, and it's incredibly frustrating now that we've accepted the web for banking and credit cards. And the last thing I want to say is that I read the other day, and I researched it, so I know it's true, the domain name dating.com, dating.com, like dating as in, hey, let's go out on a date. Someone sold that domain name for $1.7 million. Now, what does that have to do with healthcare? My point here is that someone paid that much money because they know that they could use the web to entice so many people for their business. Well, and again, this may sound self-serving, but there are other people who own domains like I do. But I own hospitalpatient.com, .net, .org. I think I own 10 in total, .info, .biz, .tv. I think some company should buy those domains to orchestrate a marketing plan, because people use the web nowadays. That's what we pay attention to. That's why someone paid $1.7 million for dating.com. So these incredibly bright people have a tremendous amount of opportunities. They need to capitalize them. If it's not hospitalpatient.com, go after some other sites. But I think it could announce your services or your products so quickly to the masses that right away technology would have such a quick impact on healthcare, and chronically ill people would be that much closer to getting treatment. So thanks for listening. And again, my book, I gotta hawk it because people tell me it's really good. So I like to get it to as many people as possible. It's Confessions of a Professional Hospital Patient. Hospitalpatient.com is where you could purchase it, or at Amazon or Barnes & Noble. And I really appreciate the audience. And if you have any other issues you'd like me to address, just email me at michaelweiss@hospitalpatient.com, or you could just send me a tweet. My Twitter name is Hospital Patient. So thank you very much.